After the age of 50, many people begin to find climbing stairs more difficult, walking less flexible, and even experience fatigue or frequent falls. This is often mistaken as a normal sign of aging, but in reality, it is the result of multiple accumulating causes and entirely preventable if recognized early. Declining leg strength doesn't just affect mobility, it threatens independence, quality of life, and mental well-being in older adults. Legs are not merely tools for movement, they are the foundation of a healthy and free life. Ignoring this condition can trap the elderly in a vicious cycle: reduced activity, muscle loss, falls, immobility, loss of independence. But the good news is, this situation can absolutely be changed. With the right knowledge, practical strategies, and a suitable lifestyle, preserving leg strength is entirely within reach. Start today, step by step, to stay in control of your movement in old age. Strength doesn't lie in age, but in the choice to act at the right time. Sarcopenia, also known as age-related muscle loss, is a silent process that begins after the age of 30 and becomes more pronounced after 60. At this stage, the body gradually reduces both the number and size of muscle fibers, leading to a decline in muscle strength over time. This directly affects mobility, balance, and endurance in older adults, increasing the risk of falls and loss of independence in daily activities. However, sarcopenia is not a destiny. With proper exercise and a balanced diet, we can completely slow down or even reverse this process. Light resistance training such as using dumbbells, resistance bands, or even simple movements like standing up and sitting down can help maintain and rebuild muscle mass. At the same time, nutrition plays an extremely important role. Older adults require more protein to maintain muscle, so it's essential to regularly include protein-rich foods such as lean meat, eggs, milk, and legumes in daily meals. Strong legs start with proactive action today. Peripheral neuropathy is one of the most common causes of leg weakness and reduced mobility in older adults. This condition occurs when the peripheral nerves, especially those in the legs, are damaged, leading to symptoms such as numbness, tingling, pain, or loss of sensation. The two main causes of this condition are long-standing diabetes and vitamin B12 deficiency. In people with diabetes, persistently high blood sugar levels gradually damage the nerves over time. In cases of vitamin B12 deficiency, often seen in individuals with poor nutrition or impaired absorption, severe nerve damage can also occur. To improve this condition, it is essential to manage blood sugar levels effectively through diet, exercise, and medication as prescribed by a doctor. At the same time, it is important to supplement vitamin B12 through foods such as liver, eggs, dairy products, red meat, or supplements if necessary. Early detection and proactive treatment are the best ways to protect nerve function and maintain strong, healthy legs as we age. Peripheral artery disease, PAD, is a condition in which blood vessels, particularly in the legs, become narrowed due to the buildup of atherosclerotic plaques. When arteries are constricted, oxygen-rich blood cannot be adequately delivered to the muscles, especially during physical activity. A common symptom is pain or fatigue in the calves while walking, known as claudication. This pain typically subsides with rest, but if left untreated, the condition can worsen and severely impair mobility. One of the most effective solutions is to engage in guided walking programs. Regular and properly performed walking helps stimulate blood circulation, enhance blood flow to the leg muscles, and improve symptoms. Additionally, it is essential to quit smoking, a major factor that accelerates blood vessel narrowing, and to manage blood pressure and cholesterol through a healthy diet, exercise, and prescribed medications. PAD is a serious condition, but it can be well controlled with early intervention and a consistent, science-based lifestyle. Don't let your legs be forced to stop midway due to a lack of blood supply. Vitamin D deficiency is common among older adults and is a silent contributor to muscle weakness, particularly in the legs. As the body ages, its ability to synthesize vitamin D from sunlight through the skin decreases. And kidney function, where vitamin D is converted into its active form, also declines. As a result, muscles become progressively weaker, reflexes slow down, and the risk of falling increases. especially when walking on uneven surfaces or climbing stairs. To prevent this condition, one of the simplest methods is sun exposure, spending 10 to 15 minutes in the morning sunlight, 2 to 3 times a week. In addition, dietary sources of vitamin D are also important. Foods rich in vitamin D include salmon, mackerel, egg yolks, and vitamin D fortified milk. In many cases, especially for those with limited sun exposure or poor absorption, taking vitamin D supplements as prescribed by a doctor is necessary. Maintaining adequate levels of vitamin D not only strengthens bones but also helps keep the legs stable and prevents fall-related accidents in old age. A sedentary lifestyle is a major cause of progressive muscle weakening, especially in the legs. When the body is not exercised regularly, muscle fibers shrink due to lack of stimulation, which reduces mobility, impairs balance, and increases the risk of falling. In older adults, this process occurs more rapidly, as natural muscle degeneration is already taking place. However, improvement does not require intense or demanding workouts. Simple and gentle activities such as walking around the house, swimming, or practicing Tai Chi daily can help maintain muscle flexibility, improve circulation, and boost confidence in movement. The most important factor is consistency, not vigorous exercise, but regular activity, starting with small steps like standing up every 30 minutes. Walking 10 minutes a day, or joining community exercise groups can yield noticeable benefits. Remember, the less you move, the faster you lose muscle. So don't let your body stay idle for too long. Osteoarthritis, especially in the knees and hips, is a common cause of pain and reduced mobility in middle-aged and older adults. As cartilage, the tissue that reduces friction and absorbs impact, gradually wears down over time. Joints become dry, stiff, and painful during movement. As a result, patients often avoid physical activity, causing the surrounding muscles to weaken and worsening the condition. However, proper movement is actually an effective medicine for improving osteoarthritis. Low-impact exercises such as cycling, swimming, or aquatic activities help reduce joint stress while increasing flexibility and blood circulation. Additionally, strengthening the muscles around the joints, particularly the thighs and glutes, through moderate exercises like light squats or leg presses is crucial. When these muscle groups are strong, they help offload pressure from the joints, reduce pain, and make movement easier. Maintaining an appropriate exercise routine is the key to living with osteoarthritis while still keeping your legs strong and stable. Side effects of medications are a silent but very real cause of muscle weakness. Especially in older adults, some commonly used drugs, such as statins, for high cholesterol, and corticosteroids, anti-inflammatory, can lead to a condition called drug-induced myopathy, muscle damage that causes pain, weakness, and reduced mobility. When this occurs, many people often mistake it for natural aging and overlook the need to review their current medications. It is important not to stop taking any medication on your own but to consult directly with a doctor. The doctor may adjust the dosage, switch to a medication with fewer side effects, or recommend supportive strategies such as exercise and nutritional supplementation. Monitoring your body for signs and getting regular checkups can also help detect these adverse effects early. Remember, every medication has benefits, but only when used correctly and for the right individual. Staying in regular contact with your doctor is the best way to protect your muscle health and maintain strong, healthy legs. Osteoporosis is one of the leading causes of fractures in older adults, especially hip fractures, the most dangerous type, as they often result in prolonged immobility, rapid muscle loss, and severely impaired mobility. When bones become brittle and weak, even a minor trip or small bump can lead to a fracture. However, osteoporosis is not inevitable and can be prevented. Adequate intake of calcium and vitamin D is a fundamental step in maintaining stable bone density. Calcium strengthens bone structure, while vitamin D enhances the body's ability to absorb calcium effectively. In addition to proper nutrition, appropriate physical activity is a key factor. Gentle exercises such as walking, heel raises, and light weight training help stimulate bone growth and maintain muscle mass that supports the joints. It is especially important to undergo regular bone density screenings, particularly for postmenopausal women and individuals over 60, to detect early signs of osteoporosis and apply timely interventions. A strong skeletal system is the foundation for healthy legs and an active, independent old age. Obesity, especially sarcopenic obesity, which is obesity accompanied by muscle loss, is a common yet often overlooked cause of leg weakness and reduced mobility after the age of 50. When body weight exceeds healthy limits, weight-bearing joints such as the knees and hips become overloaded, leading to faster degeneration, pain, and restricted movement. At the same time, when fat mass increases while muscle mass decreases, the muscles become less efficient, weaker, and more easily fatigued, directly impacting leg strength and stability. To improve this condition, it is essential to lose weight in a safe and controlled manner, avoiding extreme or rapid weight loss methods. The ideal exercise regimen should combine light cardio activities such as walking or cycling with muscle-building exercises like yoga, Pilates, or resistance band training. When the body reduces fat and builds muscle simultaneously, the legs become more flexible, stable, and less prone to injury. Obesity is not just a matter of appearance, it is a direct barrier to your freedom of movement, one that you can absolutely overcome with the right actions. Stroke is a serious medical event that can cause paralysis on one side of the body, severely affecting mobility, especially in the legs. When blood flow to the brain is interrupted, the areas responsible for movement are damaged, leading to muscle weakness, loss of balance, and difficulty walking. Stroke survivors often become dependent on others or assistive devices for mobility, which significantly reduces their quality of life. However, stroke is largely preventable if risk factors such as high blood pressure, cardiovascular disease, diabetes, and lipid disorders are well managed. Maintaining a healthy lifestyle, eating a balanced diet, exercising regularly, and having routine medical checkups form the foundation for stroke prevention. For individuals who have already experienced a stroke, rehabilitation plays a crucial role in improving mobility and increasing the chances of recovery. Specialized exercises combined with assistive devices like walkers and canes help patients regain confidence and walking ability. Proactive prevention is the key to keeping your legs strong and steady in the face of stroke risk. After the age of 50, maintaining leg strength and mobility is no longer a simple matter. In reality, leg weakness is not caused by a single factor, but is the cumulative result of various physiological and lifestyle-related elements over time. From age-related muscle loss, sarcopenia, to vitamin D deficiency. From vascular diseases to medication side effects, all of these silently erode mobility if not recognized and addressed in time. As the body ages, muscle mass and bone density naturally decline. This is a biological rule, but not one that must be accepted passively. Physical inactivity, a diet low in protein, and deficiencies in vitamin D and B12 accelerate this decline, especially for those with chronic conditions such as diabetes, hypertension, high cholesterol, or a history of stroke. The risk is even higher due to impaired nerve and circulatory function. Not to mention obesity, where excess fat not only overloads the joints but gradually replaces muscle fibers, reducing movement efficiency. Moreover, commonly used medications such as statins and corticosteroids, though necessary for treating underlying health conditions, can contribute to muscle weakness if not properly monitored. Combined with a mindset of avoiding exercise or lack of access to physical training, many older adults gradually lose control of their legs without even realizing it. The most important thing to understand is, all of these causes can be prevented, managed, or improved, if we act early and correctly. Adjusting one's diet, supplementing key nutrients, engaging in light regular exercise, attending routine health checkups, and managing medications under medical supervision. Every small step contributes to significant long-term benefits. Remember, strong legs don't come from luck, they come from taking initiative. Starting today, you are choosing to build a solid foundation for an active, independent, and dignified old age. In summary, there are at least 10 causes of leg weakness in people over the age of 50, from muscle loss and vitamin deficiencies to chronic illnesses and medication side effects. The good news is that most of these causes can be prevented and improved if you take a proactive approach to your health. The key lies in maintaining a healthy lifestyle, exercising regularly, and having routine checkups to detect potential issues early. Leg strength doesn't just determine your ability to walk, it symbolizes independence and freedom in later life. You don't need to start with major changes, just choose 1 or 2 small actions today. Like taking a 15-minute walk, eating an extra egg, or scheduling a joint and bone checkup with your doctor. Small but consistent steps can lead to significant changes over time. Remember, strong legs are the foundation for an independent old age. Taking care of them is not just an investment in your mobility, it's an investment in your long-term quality of life.